Okay guys, today we're going to talk about the picture labeling of the lower limb for our test, and we will not cover the complete lower limb but some specific pictures, those they are required. So here we go to the main topics for today, and we can start from the bone labeling and then to the joints and the ligaments, then the transition area, not all, just only these two, and the muscles from thigh leg, specific views, and the arteries from the thigh and leg, the main one, and the last one, the nerves we will talk about. Here we go to our first picture, the pelvic bone, which is also known as the hip bone. This is the lateral view because the lateral view is required in the our how to say lower limb. As we can see that this picture is representing the three colors. The upper part here, which one is the yellow, that is representing the ilium, and the blue portion is representing the ischium, and the red portion is representing our pubic bone. Now we can come to the very important structures on its lateral side, where these three bones fuse together. We call that acetabulum. In the acetabulum we are having here the articular and non-articular part. So this place we are having the acetabular fossa, and here we call acetabular notch. Next, we can come here on the marking of the ilium. In the ilium, first of all, we can see that this broad portion of the ilium, we call that ring or ala of the ilium, which is also known as the gluteal surface of the ilium. And then we can come here on the iliac crest. This iliac crest is like this from here to here. On the iliac crest, this place we are having the tuberculum of the ilium, where the iliotibial tract will attach. Anteriorly, this point we call that anterior superior iliac spine. This one anterior inferior iliac spine. Backside posteriorly, this one is the posterior superior iliac spine. This one is the posterior inferior iliac spine, and this place here is the greater sciatic notch, this one. Except this marking, we are also having the three gluteal lines here. As we can see, this one representing the posterior gluteal line as its location, and we got here anterior gluteal line, and in most inferiorly, this one is the inferior gluteal line. Except this, at this place we call that this is the body of the ilium. Now we come to the pubic bone. On the pubic bone we are having the very important, this point is the pubic tubercle. It is having the two ramus, superior and the inferior pubic ramus. At this place we are having the obturator crust. Now we come to the ischium bone. Ischium bone, very prominently here one spine, we call that ischial spine, and below the ischial spine we are having the lesser sciatic notch. Here we go the body of the ischium, and below that we are having the very prominent ischial tuberosity, and ischium is also having the ramus. So the ramus of the pubis and the ramus of ischium sometime together also known as ischiopubic ramus, and here there is a foramen, we call that obturator foramen. second bone we are going to talk about today, that is our thigh bone, femur. So this side we are having the anterior view, and this side we are having the posterior view. Let's talk about here the first thing, head of the femur. On the head of the femur, you see a small depression. We call that fovea for the ligament of the head. Here is a little bit prominent. After that, we are having here the neck of the femur. Then we are having the greater and the lesser trochanter. Between the two trochanter, anteriorly, we are having the intertrochanteric line, and if we see posteriorly, we are having the intertrochanteric crest. At this place, we are having the fossa. We call that trochanteric fossa. Except that we can see here posteriorly very prominent marking. We call that linea aspera, and it is having two lips here. The medial side one we call medial lip, and lateral side one we call lateral lip of the linea aspera. Very prominently posteriorly at this place we are having the gluteal tuberosity. Except that inferior to the lesser trochanter, here we are having the pectineal line. In the shaft we can also see the one foramen here, that is the nutrient foramen. When we come inferiorly, then we can see here the surface posteriorly, that is the popliteal surface, and anteriorly we can see the patellar surface. Two round articulation here are representing the condyles, medial and the lateral. Between the two condyle there is a fossa. We call that intercondylar fossa. Above the condyle, both sides, we are having the medial and the lateral epicondyles. And above that, we are having at this place medial and the lateral supracondylar line, respectively. Now we are here on the ligaments and also the hip joint. So when we are talking about the ligaments, first of all, we need to know that this is the anterior view and the posterior view. So in the anterior view, except the marking, we need to pay attention that here we are having the pubic bone. So from the pubis to the femur, pubofemoral ligament, and from the ilium to the femur, we are having the iliofemoral ligament. And here we can also see the very prominent bursa. This bursa is the iliopectineal bursa. Iliopectineal bursa. In the posterior view, we can see the ischium bone here. So from the ischium to the femur, we call that ischiofemoral ligament. Now we come to the hip joint. In the hip joint, we can see that this ball and socket joint formed by the socket of the pelvic bone, which is the acetabulum, and on another hand, the head of the femur is working as the ball. So we can see here as the marking the head, which is capped with the hyaline cartilage, and here there is a ligament which is torn here to visualize the structure, ligament of head of the femur. The next one, that in the acetabulum we are having the lunate surface, which is also the hyaline cartilage, and outside here there is the acetabular labrum, that is the fibrous cartilage. Inside here, acetabular fossa, we can see the fat there in the acetabular fossa. This lunate surface downside is also having the ligament. We call that transfer acetabular ligament. Except that in the obturator foramen, you can also see that it is covered with the membrane, that is the obturator membrane. We go to the next picture, that is the knee joint with its ligament. We got here the femur, tibia, fibula, anterior view, and downside here is the posterior view. We got first of all on the femur, we are having here that is the medial lateral condyles respectively, and in the middle here we're having the two ligaments. Anterior one is the anterior cruciate ligament and posterior one is the posterior cruciate ligament. Except that we can see medially the medial collateral ligament and laterally lateral collateral ligament. Those they also known as tibial collateral and the fibular collateral ligament. We can also see here the meniscus, medial and the lateral meniscus. They are the cushion for the knee joint formed by the fibrocartilage. When we see the posteriorly we are having here this one as it is attaching with the meniscus. Okay, we call that posterior meniscofemoral ligament. Now we go to the next picture. In the next picture we are having the ligaments from the foot or ankle. This one, the above picture, is representing the lateral side and the below picture representing the medial side of our ankle joint. Let's do some ligaments here from the lateral side first. This one is the anterior tibiofibular ligament, and here we are having posterior tibiofibular ligament. Then we got here the anteriorly at this place. This is the ligament present between the tibia. We are having here on the next picture, in which we can see that the ankle joint, this is the lateral side and this is the medial side. So let's talk about some important things on the lateral side. After talking about the bones, tibia, fibula, and here we are having the talus and the calcaneus, it will help us to memorize the ligaments name. Between the tibia and the fibula, anteriorly, tibiofibular, and posteriorly, posterior tibiofibular ligament. After that, we are coming here on the lateral ligaments of our ankle joint, in which you see here number 1, number 2, and the number 3. These 1, 2, and 3, let's talk about number 1 and 2 the first. Number 1 and 2 are the anterior and the posterior talofibular ligament respectively. And number 3 is the calcaneofibular ligament. So these 3 ligaments collectively known as the lateral ligament of the ankle. Except that we can see here on the calcaneus, this is the Achilles tendon, also known as calcaneal tendon. And here we got the 2 lateral muscles tendons coming here, fibularis longus and the brevis. They are secured by the 2 ligaments here, superior and inferior. The superior and inferior fibular retinaculum, they are known as superior and inferior fibular or peroneal retinaculum, respectively. Now we come to the medial view here. In the medial view, again, need to know that we can see the tibia, we can see here the talus bone, we can see here calcaneal bone, okay, and here is the navicular bone. Now we see here from the tibia at this place we're having the four ligaments. They are making the medial ligament of the ankle. I want to point out number one, this one here, and the number two, this one posteriorly. So anterior and the posterior tibio-talar ligament, anterior and posterior tibio-talar ligament. Then we got here from the tibia to the navicular, and from the tibia to the calcaneus, this one. So we got here tibio-navicular and tibio-calcaneal ligament. These four ligaments are known as the medial ligament of the ankle, collectively also known as deltoid ligament of the ankle. Except that, again, Achilles tendon we can see here. We can see the short and the long plantar ligament here. Except that in this place, this one, we can see the plantar-calcaneonavicular ligament. Now the next picture is the first transition area of the lower limb, which we call that femoral triangle. On the femoral triangle, what we need to get, we are having first of all anterior superior iliac spine, and then we are having the pubic tubercle here. So between the anterior superior iliac spine and pubic tubercle, there is the inguinal ligament. And then the lateral boundary, that we are having the sartorius muscle, and here we are having the adductor longus muscle. This nerve here is the femoral nerve, femoral artery, femoral vein, and we are having the superficial inguinal lymph node. Next, we go to the second transition area, that is known as the popliteal fossa, which is a diamond shape. We can see here, first of all, at the upper side, we are having the bicep femoris muscle. Upper medial side, we are having the semimembranous and the semitendinous muscle. Lower side, we can see here the gastrocnemius, lateral and medial head. And now we talk about the content, in which we can see popliteal artery, popliteal vein, tibial nerve, common fibular nerve. Here we got superficially the small spinous vein. Now in this picture we can see the muscles of the anterior compartment of the thigh, and some belong to the medial. First of all, I want to say that we can see here a small muscle here that is representing our gluteus medius muscle, and here we are having the tensor fasciae lata muscle. We got here iliacus muscle, we got here psoas major muscle, pectineus muscle, we got here adductor longus muscle, gracilis muscle. Now we come to this strap-like muscle, that is sartorius, and we got here the quadriceps femoris muscle, vastus lateralis, rectus femoris, vastus medialis, and when we cut this rectus femoris, under that we can see the vastus intermedialis. In this picture, we can see here the three views in which we are having the superficial view of posterior side of the leg, deep view of the posterior side of the leg, and the lateral view of the leg muscles. We can see here the cut part of the gastrocnemius muscle, medial and the lateral head respectively. Then a very small muscle we can see here, that is our plantaris muscle. Under that there is another one that here we can see, that is the popliteus muscle. Then we can see here the soleus muscle, and then the cut part remaining of the gastrocnemius muscle. Now we come to this picture in which trying to represent the deep one. One of the deep here, popliteus, I mentioned already. Next, these three muscles we need to identify. So in which we are having here, first of all, the flexor, this one, that is the flexor digitorum longus muscle, because from here it is going to the digits. And then in the middle, this muscle, that is the tibialis posterior muscle. It will finish here in the middle of the foot. Next, we are having here this one. This one is our flexor hallucis longus muscle. Now we come to the lateral view. In the lateral view, what we can see here? First of all, in the lateral view, we need to differentiate these two muscles, 1 and 2. They are respectively fibularis longus and the brevis muscle. And then most posteriorly in this view, we can see here that the gastrocnemius, under the gastrocnemius we can see here the soleus muscle. Now we come to the anterior part here. Anteriorly we can see the tibialis anterior, this one, and after that we are having the extensor digitorum longus muscle. Okay, and if we go down, that you can also find the at this place the extensor hallucis longus tendon here. We are on the next picture in which we can see here the arteries. First we talk about the arteries of the thigh here, and then we will go to the legs. So first of all we can see here, this is the external iliac artery. This external iliac artery will form the femoral artery, which is here. So external iliac artery, the branches too we can see here, which one is going on the iliac side, that is our deep circumflex iliac artery, this one. And this one here is our inferior epigastric artery. Then right after transfer this external iliac artery into the femoral, there are 4 small cutaneous branches here, in which we can see here this is superficial circumflex iliac artery, and this one is our superficial epigastric artery, and here we are having the 2 pudendal one, which we call them the superficial and the deep external pudendal artery respectively. In the obturator part we are also having the obturator artery, but that is not coming from here. We got here a very big branch of the femoral artery here. We call that the deep femoral artery or profundus artery of the femoris, which is giving very important 2 branches here. We call that medial and lateral circumflex femoral artery. Then we can see on its core is giving the 3 perforating arteries, first, second, and third respectively. Okay, and then the last one we call that terminal perforating artery of the deep femoral artery. Now this femoral artery is passing through the adductor hiatus. After passing through this artery is going to change its name going to the posterior side. We call that popliteal artery. Now the story of the popliteal artery here at the knee, posterior side, and then at the knee, these branches. Mainly need to remember the four branches here, medial side, two, and lateral side, two. We call them superior medial, superior lateral, inferior medial, and inferior lateral genicular arteries. Those that give the supply to the knee joint. Now the popliteal artery is giving the branch posteriorly, posterior tibial and the anterior tibial, which is coming anteriorly. This anterior tibial will carry on downward and then on its course at the ankle joint is going to give the arteries, what we call that, the anterior medial and the lateral malleolar artery respectively. And then it is giving the medial and the lateral tarsal branches here, and it will finish as forming the dorsal pedis artery. Posteriorly, this posterior tibial is going to give the one branch, as we can see here, this one, which will go like this way. This branch known as the fibular artery, which is coming from the posterior tibial. This posterior tibial will reach into the sole of the foot and will give the two branches. Main one, medial side, the medial plantar, and lateral side, we call that lateral plantar artery. Okay, now we are here on the nerves, lumbosacral plexus, in which we can see starting from the L4, L5, then S1, S2, S3, S4, S5. So we need to get to the important branches here. Root you should know. After that, we are having first of all L4, L5. This collectively we call that lumbosacral trunk. Now we can see here the very three important one here. Well, this one is the superior gluteal nerve. Then we are having inferior gluteal nerve. Then we are having here nerve to the piriformis. After that, we can see here the yellow part posteriorly and green part anteriorly. This green part we call that tibial part, and the yellow part we call that common fibular part. These two collectively we call them sciatic nerve. This one here is the nerve to the quadratus femoris and also to the inferior gemellus. This one is the nerve to the obturator internus and also the superior gemellus. This part here, this one, is the posterior femoral cutaneous nerve. This one is the perforating cutaneous nerve. This one is the pudendal nerve. This one is nerve to the levator ani and coccygeal muscle. This one is the perennial branch of the fourth sacral nerve. At this place, we are having the coccygeal nerve, and the downside to this one, we call that anococcygeal nerve. We are having the last picture of this tutorial, in which we can see here the L1, L2, L3, L4 anterior ramus here, and we got here from the L1, that is the ilioinguinal nerve, and at this place we can find the lateral continuous nerve of the thigh. This very prominent one, this one is the femoral nerve, and beside this we are having the femoral branch of genitofemoral nerve, and here we can see this one, that is the obturator nerve. And if we come to this side, we are having the lumbosacral trunk, this one. And this place need to be very careful that the very small one superiorly, this one is the superior gluteal nerve, and this tiny one, that is the inferior gluteal nerve. After that, we can see here the very tiny small one at this place, this one. This is representing the perforating continuous nerve. And the next one that we can come here at this place, this is the posterior cutaneous nerve of the thigh. And the very prominent, this big one, that is representing the shattuck nerve. And there is also a small portion here. This one is representing the nerve to the quadratus femoris and the obturator internus. Thank you.